Well, good afternoon, everyone. Thank you for joining us for meeting the challenges of aging and disability together. We at the Kenosha Public Library are pleased to partner again with the Kenosha County Aging and Disability Resource Center and honored to welcome Ms. Sampson as a presenter. I'm Patty Bajabier, an adult and digital services librarian. Helen Sampson is a licensed clinical social worker with over 30 years of experience in direct practice and program development in home and community-based health and human service settings. Her practice has been focused primarily with older persons and adults with disabilities. She has worked in public and nonprofit settings in Massachusetts, California, and Wisconsin. Helen's current position as the quality coordinator with the Kenosha County Aging and Disability Resource Center began in 2010. She has also served as an adjunct professor at Carthage College, teaching macro practice in the social work department. Helen has been the facilitator of the Kenosha County Care Transitions Coalition since its inception in November 2011. Helen lives in Pleasant Prairie with her husband and 2 Great Danes. I will now turn the program over to Helen. Thank you.
Thank you very much, Patty. I'm delighted to share this information with you today, and I am also delighted by the partnership that we enjoy with the Kenosha Public Library. I am going to just be pretty informal, although I do have some slides that I will go through, and I welcome questions as we go. I would rather have anything that comes up in the moment get addressed in the moment than be forgotten. And the other option is to put things in chat. And although I cannot see chat because I'm sharing my screen, I'm thinking, Patty, you could maybe help me with that.
Xander will help with that as moderator.
All right. Well,
Thank
whoever
you.
wants to help, I'm open to it. So we're going to talk about some of the challenges of aging and disability, and more importantly, we're going to talk about some of the resources that are available. Now, why is my screen not moving? There we go. Here's kind of the plan. I'm going to take quite the aerial view here. This is a huge topic that I'm trying to mush into an hour of conversation. So we're going to go over some of those challenges, but not really in depth. And then I really want to spend the bulk of our time on, and with those challenges, what are the actions that we can take to best address them? I guess one of my first questions are the people on the call today more caregivers, or are you interested for your own self?
Both.
Both.
I don't know.
Okay, there you go. I can, yes. Thanks,
yeah,
Faye.
Both.
Okay. All right. Well, very good. So you've got that double hat.
Yeah.
And hopefully this will give you some direction. Okay. So we're going to talk about challenges and then what we can do.
Okay.
So, you know, as much as there's been a pursuit for the fountain of youth, it has not been successfully claimed. And science has done a lot for us, but, you know, our longevity is greater, but we are designed to stop at some point. And in that stopping process, there is decay, whether that's physically or cognitively or even emotionally. You know, we peak physically in our early 30s, late 20s. We peak cognitively with our short-term memory at the age of 25, which is the age of my daughter. I'm going to now be able to, kid her about her memory because she's been doing it for years with me. The good news for everyone is that our emotional well-being tends to peak much later in life. Life satisfaction peaks at age 69. Overall well-being at age 82. So this is good news for us. But again, the expectation for some changes and some decline as we age is our reality. And certainly those changes are in and of themselves, my eyesight may change, my hearing may change, my flexibility may change, but it's really not so much the what, but the how that impacts my life. And we talk about the how in terms of activities of daily living and instrumental activities of daily living. Those ADLs are, does my health condition or cognitive condition impact my ability to walk, to feed myself, to dress and groom myself, to toilet, to get up out of a chair, or to bathe myself. Those are the big ones. And then we also talk about instrumental activities of daily living. While the ADLs are really about our person, the IADLs are about our world. So can we manage our money well? Can we manage getting to the doctor? Shopping, meal preparation, housekeeping, all of those things that make our world function. Can we manage our medication? Do I know how to pick up the phone and dial 911 if I need it? So those changes that may happen for each individual in their own unique way, depending on their genetics and their lifestyle and their luck, will impact the ability to function in very different ways. And that's really what we're looking for, because it's our ability to function in our lives that keeps us independent. One of the other big changes and challenges for folks certainly is financial security. As people retire, we hope that there was some good planning and some ability to build up some finances for your retirement. But for a lot of people, that's just not possible, right? It's paycheck to paycheck, and then you get to the point where you're done working and you've got to live on whatever you have. And usually it's a little bit less, if not a lot less. So financial security is another one of those big challenges. And there's no looking forward to some other source coming. So we're at the point in our old age or in our retirement that we've stopped earning. It's a limited pot. And the last thing, some of those challenges in aging and in disability is having to do with our overall well-being. And I talk about this because there's been so much research around well-being impacting our production of anti-inflammatory proteins. So well-being, feeling like you have purpose in life, having connection and relationship, being able to have mastery, all those things we just talked about in terms of ADLs and IADLs, being able to make your own decisions and having some sort of personal growth and really accepting yourself. All of those things really impact our physical health as well. So they get more challenging in some ways because as people retire and they're not in the workforce, as losses occur within the social network, your spouse dies or your friend system dies, the isolation and the ability to have really good relationships are challenging. So I want to do a couple considerations, and I'm going to roll right into that isolation bit. I mean, certainly we've talked a lot about isolation in the last year and a half with COVID. Our whole world has come to understand the impact of not being able to connect with each other. This is something that older adults have known forever. That huge piece of what feeds us as human beings was really stretched. And one of the studies that I read compares isolation and the ability to not have that connection to the health impact of smoking 15 cigarettes a day. Wow.
Wow.
Right. That's how important it is for us to have that sense of connection. And certainly we have developed some alternatives with, our virtual technology and phone, and that does help, but it does not replace a hug, a hand, a being with. So that isolation piece is a big one for this population of people. The next thing I want to talk about briefly is falls. This is another special consideration. Wisconsin has a horrible falls track record. It is the leading cause of accidental death for folks 65 and over. In Kenosha during 2020, 75 people died from falling. That's a lot. And it is another one of those disrupting challenges that happens far too frequently. Another statistic, 20% of people admitted to a nursing home have had a fall in the 30 days prior to admission. So that it certainly raises that risk factor of needing nursing home care. Breaking something, having to go to the hospital, having to get rehab. It's very disorienting. It causes a lot of havoc for people, and it happens way too frequently. And we've got some resources around that. So when people tell you to pick up your scatter rugs or put that grab bar in the bathroom, it's for a very good reason. I also want to talk about, sort of the difference in a rapid onset of a problem and more of a slow decline. I think there are challenges under both, but let's say someone has been really healthy and out of the blue has a stroke, or a younger adult is, we're coming into motorcycle season and my heart pounds every time I see someone without a helmet on. God forbid there's that accident and that person ends up with a traumatic brain injury. Those are dramatic, rapid onset problems that people haven't planned for, didn't expect. And the swirl around trying to catch up with how do you cope with those and how do you construct a new life with those kinds of situations is very challenging. On the flip side, for people who have more chronic illnesses, that sort of more gradual decline is a little easier to not see, not really attend to, accommodate a little bit every day until you really need help and you're not feeling prepared for that either. So both are tricky. They just are dealt with differently for people, but that is definitely one of the challenges. The next challenge is denial and resistance. So whether you are thinking about your own care for the future, or you are caring for someone else. I often hear adult children talking about, mom just won't do this, dad just won't do this. And I want to remind those adult children who love their parents dearly that they get to make their own choices in life. I think denial has a really bad rap, first of all. It is a highly functional mechanism, psychological mechanism, that gives us the amount of space we need to build our internal resources and our external resources to face something that is big. So that's part of what we're going to do today, is look at how do we build those resources so we can face those problems. Resistance. I always want people to put their hands together and feel what happens when one hand pushes against the other. You almost automatically push back with the other hand. So anytime there is pushing, there's going to be resisting. But if you can just relax and hold them together, then you have a prayer's chance. So when we try to push someone towards something that they're not ready for, people will push back. It's just our nature. But when we can walk with them side by side and just talk about the options and get their thoughts, it's a much more productive process. The last thing in terms of special considerations is just kind of that level of care. There are so many physicians, and God love them, I'm not bashing physicians, who will tell their patients or their patient's family, oh, it's time for assisted living. And I always feel like that's that, put a sweater on because I'm cold. If people haven't really explored all the options, then they don't know what's available and what can exist. So I think there are times for sure that people go into assisted living too soon. And then of course, there are times where you're a little behind the 8 ball. Some of the reasons that caregivers make that decision with their, hopefully, their loved one is that they just need more skilled care that can't be easily provided by an untrained person. The caregiver's health is compromised. We're going to repeat this theme a lot. And the patient's dementia-related behaviors are another big reason. And lastly, just the need for more assistance. So those are the reasons that people start looking at different levels of care. Okay, so our first action, we got some of the challenges, swept over that pretty quickly. Our first action in response to those challenges has to be information. I talk about the Aging and Disability Resource Center like my mother's purse. Oops, I don't know why it went forward. My mom had one of those magical purses that, I forgot to brush my teeth and out comes the dentine. My stomach is gurgling in church and out comes the dinner roll from the supper club she and my dad went to the night before. It was just a bottomless bag of goodies. And that's how I think about the ADRC. But the one thing that ties all of those goodies together is good information. So we have information and assistance. We're going to talk about that in a little while. And we also have options counselors, people who will sit with you, specifically look at your situation and help you figure out what the best options to meet your needs are. We have transitions options counselors that work with kids that are leaving the children's system and going into the adult system. So that's one of those transition areas that can feel confusing and challenging for everybody, but at 17 and a half, we can start helping you put that plan together for your adult life. We have health and wellness programs, some evidence-based classes that help people manage their diseases, and we have classes that run for caregivers to help them take better care of themselves while they're doing this difficult job. We have a falls prevention class. So the health and wellness is really, we're trying to get ahead of the problems, and get you as tooled as possible. Adult Protective Services helps us really keep people safe who are in vulnerable situations and may be taken advantage of financially, may be neglected or self-neglecting, just are in a vulnerable situation and need someone to step in and first of all, understand the situation and then find ways to shore up the supports. Outreach and education, we are constantly letting people know that we're here because, if you don't know us, you can't turn to us. And we want you to turn to us because we are, we're really rich in resources and we have the same goals that our clients have. Education, doing things like this all the time in the community. We do have a medical equipment loan closet, so you can borrow a wheelchair indefinitely. You can borrow a walker. We have incontinence supplies, which are very expensive. So people will come and pick up those supplies and save a few bucks in their budget. Caregiver support services is a really important part of what we do, and also our dementia care services. And I'm going to talk a little bit more about those as well. But this is my mother's purse. What you need, she will find. So the first stop when you are connecting with the Aging and Disability Resource Center is our information and assistance staff. They are in the office Monday through Friday, 8 to 5 p.m. There's always 3 of them on the phone at any moment. And they take those calls. And I really challenge everybody to figure out something to call them about, because it's very simple and very pleasant experience. So once you do it, then you know that it's an okay thing to do, that we welcome the call, that we're going to help you with any question. And even if we don't know the answer, we're gonna help you figure out the next best step. We also take email. So you can email us at adrc@kenoshacounty.org and someone will get back to you within 24 hours. So one of the big pieces of this information and assistance role is that we are accurate and unbiased. Accurate is most important. So we have a full-time staff member who's maintaining our database, making sure that our resources are up to date, because we don't want to waste your time. And having the right information is how we build trust with this community. The unbiased part is really important too. And that is, this is your journey. We don't know what's right for you. We're going to talk to you about that. And we're going to listen to what are your preferences. And we are going to ask some questions so we get a better idea about what makes sense to you. But we don't have a horse in this race. This is your journey, and we're going to give you choices. Now, I know a lot of people at the point at which they get around to calling us are burned out, they're overwhelmed, they're, really struggling, and they just want us to tell them what to do. And we can't do that because it's your choice. what we will do is support you to come to that decision for yourself, and know the right questions to ask. But promoting any service over any other is really not, how we build trust. And one service can be right for someone and not right for someone else. And it really is a journey and a process. Does that make sense so far?
Yeah.
Anybody have
Yes.
questions?
I have a question about the directory. I know that you have the directory online, both in English and Spanish.
Yes, we do. And also
but
printed.
can individuals come into the ADRC and obtain a print copy?
Yes, they can, or they can just call us and we'll put one in the mail.
Ah, that's good to
So
know.
either way. Now the trick, and look at you, Patty, how you lined up with my next slide. The trick with these is that the hard copy printed version is done once a year. So it's not updated throughout the year. The online version of the database, which is if you go to our website and you go to resources on the left-hand side navigation panel, and then you go over to resource database, that's getting updated all the time. So that's going to be the most accurate and up-to-date resources. But I'm not going to lie, it's a little cumbersome to look at. You got to figure out what you're looking for and what alphabet that would fall under. But it's certainly not overly hard. And worst case scenario, you can always call us and be like, where can I find this on the website? And we'll walk you through that.
Okay.
But these are some of the great resources that we have on our website. We also have what we call resource lists. So if you don't want to deal with the whole database, you just know you want the list for home caregivers. That is separate. Supported homemakers is a separate list. You just want the list for transportation. That's in there separately as well. So we try to make the information as accessible as possible, as bite-sized as you need it. We could tell you the whole book, but if you only need page 3, then we haven't done any favors, right? So it's really about making it right-sized for you. But if you have, and I'm assuming because we're on this Zoom call, you have access to the internet, the website has a lot of rich resources on it, including those lists and the directory. One of the other things that just want to mention is something called the File of Life. This is also on the website with a form that you can fill out. You can download it to your computer and fill it out. It's an emergency information card. And then it comes, you'd have to call us and we can mail you the little red plastic holder that has a metal strip on the back. I'm trying to line this up with the camera. And that goes on the refrigerator, and then you put your emergency information in it. And all of our first responders are trained in Kenosha County to look for that File of Life envelope. So they know this is your up-to-date information, and that helps them treat better if they're called to the house. So education and information, we always encourage early diagnosis of whatever is going on. I know people don't like to go to the doctor. I'm not a big fan of it myself, but understanding your conditions and understanding how to manage them And then with whatever supports you have, getting that education and information is so important to managing it well and maintaining as much quality of life as you possibly can. So what is the progression of this disease? What can I expect in the future? I just got a, cardiac diagnosis, or I got a chronic obstructive pulmonary disease diagnosis, whatever it is. Help me understand what to expect, what are the resources available, and what support services are available to my loved ones. And here's the thing, our loved ones or ourselves who have come into relationship with poor health are going to challenge the people who love them to learn new skills, because we want to show up for each other, right? That is the nature of being in relationship. So, I had to learn about rheumatoid arthritis when I started taking care of my mother-in-law and how that affected her and what that meant. And that's on me as a caregiver to learn new skills. So that's the other piece of the education. Not only are you as the person with the illness got to learn, but the people around you also. So I just threw in some good caregiver books on this slide, and that's the encouragement around information to read. If you're not a reader, to watch. There are so many wonderful videos on the internet around different conditions, to listen to other people who have had this journey, to talk with people that you trust and get their experience. All of that information is what is going to give you some guide and a map to take, as well as, your first call should always be to the Aging and Disability Resource Center. Okay, I want to talk about teamwork and collaboration. This slide is just flipping itself. I love this quote: if you want to go fast, go alone. If you want to go far, go together. And that's really, I think, the message that I want to share, whether that's calling the Aging and Disability Resource Center, whether that's working in collaboration with your healthcare providers or your family or your support people. It is not a journey that any of us should be taking alone, through health crises and through the challenges of aging and disability. So the first step in this team making, and I really believe in teams. I think that we are all raised in our culture to be independent and to feel good that we can do things on our own. And I'm afraid to say that I think that's kind of a lie. I think we're supposed to be interdependent. I think I'm supposed to use my gifts and my resources to support you, and you're supposed to use your gifts and your resources to support me. Because when I try to manage it all on my own, it doesn't ever work out so great. I get overtired. I try to do things I'm not good at. I can't tell you how many outdoor extension cords I've eaten up with the snowblower. I'm just not a good snowblower person, right? So I should maybe ask for a little bit of help, whatever it is. So first we start with what's the situation? Have we taken stock? Again, we go back to your loved one's ability to function independently. And I'll take you back to that first slide of ADLs and IADLs. What is the person really struggling with on their own? What do they need a little bit of help with? What do they need a lot of bit of help with? What are they willing to get help with? How is that functioning happening? Safety is a big concern in most homes. It's, we think about safety in terms of that fall risk, right? Those scatter rugs, those uneven steps, whatever it is, that's a concern. So the other pieces of safety, if you have someone that you're taking care of who's got a cognitive decline and wanders outside the house and goes for a walk because they're very physically fit and pretty soon does not know how to get home, that's a huge safety concern. Your own health and resources as a caregiver is another piece to put in the puzzle. Your other responsibilities as a caregiver. Do you have, other people that you're taking care of? The statistics around caregivers is the bulk of them are taking care of more than one person. What's the availability of family and friends? What are your financial resources? If you have a disability, have you explored Social Security disability insurance? Do you need some assistance with that? That's one of the things I think I skipped on our ADRC list is we have benefit specialists here, and they can assist after someone is denied Social Security disability. They can help you with the appeals process, as well as, Medicare and Medicaid and all those other benefit related issues. And then what is the late stage and end of life preparation that needs to happen? So we've assessed that. We've been honest with ourselves. We've asked other people to be honest with us. And now we can start looking around for what are some of those supports that are needed. So caregiver support through the ADRC, we've got a couple of different things. One is that we have some short-term respite funding for caregivers who need to take a break, which every caregiver should. I don't like to should people, but it's kind of a should. We also have a caregiver coalition, and one of the things that caregivers can do is call our office and ask for their name to be put on that mailing list, because we send out regularly information for caregivers, specifically resources, education, those kinds of things. And then lastly, we have two really fabulous classes for caregivers. This one is called Powerful Tools for a Caregiver, and it teaches you about how to take care of yourself while you're providing care for someone else. We have one specific for folks who are taking care of someone with dementia called Savvy Tools for Caregivers, and that teaches you the nuts and bolts of dementia and how to show up for someone with that illness. Our dementia care services are also available. We have a dementia care specialist who I'd like to clone about 10 times. And she meets with people to do some consultation around their situation, do some education around the disease, and provide some resources. We've got a few things we can talk about there. The next team piece could be this idea of care coordination. And it's defined as the deliberate organization of patient care activities between two or more people involved in the patient's care to facilitate the appropriate delivery of healthcare services. So here's the thing, it is really hard to organize. And it's always sort of this balance between I'm just going to do it myself and I need help. And when I ask for help, I need someone who's going to do it the way I want them to, because I know what I've got going on here. There's a program called Share the Care that has a website on this slide, and it helps families set up informally around organizing who gets what task and what commitment are people willing to take on. And I think it's a fabulous resource in terms of just kind of getting everybody on the same page with, there's a primary caregiver who takes the lead and then says, okay, this is where I need help. What are you willing to commit to? And then people have to be honest about what they can do. Not everybody was born to be a caregiver. So some folks are better at it than others, and that's okay. So some folks, you got to play to their strengths, right? So if you're a great shopper, then that's the role that person might be assigned. There are also some care management resources through formal agencies. Like if you are getting home care through an agency, their staff will also help with some care management and coordination of services. So that's another piece. I'm afraid I'm going to have too many slides to go through. I should pick this up. So we're talking about building a quilt here. So one of the first things that I would encourage people to do in the quilt building experience is to contact the ADRC when you've got a situation that's reached, we need help. Not sure exactly what we need, but I know things feel like they could be better with some support. And that's really an options counseling visit from one of our staff. Right now, that visit is mostly happening over the phone, or if you have access to virtual resources through Zoom or whatever, although we are doing more and more home visits as more and more people get vaccinated. So that's terrific. That options counseling visit is really sitting down with the social worker, helping the social worker understand your situation, and then they can talk with you about what are the different options. I'm going to go through a number of those today, but this is really person specific, situation specific. It's your situation that they will sit down and take a look at. Some of the other resources that we have, especially for folks who have dementia or are caring for someone with dementia, we're constantly developing resources for that because it is such a huge need in our community. Like I said, the Dementia Alive has been on hold because of COVID, but that's actually for caregivers or community members who are interested, just having a short experience of what it must be like to have dementia. We have the Savvy Caregiver and the Powerful Tools for Caregiver class, and the Memory Masters, which is for early stage folks with dementia to help them continue their social skills and their thinking skills as much as possible. And then we've got some creative engagement. Spark is a program that runs out of the History Museum, and they give folks with dementia and their caregivers a weekly experience that's wonderful and engaging. The same with, actually, I think it's monthly, sorry, it is monthly. The same with the Memory Cafe, which is literally a place where folks, people with dementia and their caregiver meet, and they have been doing this virtually since the pandemic. I think they're going to try to do one outside meeting this summer and have fun, period. There's no talking about the disease. There's just Sometimes it's a craft, sometimes it's a interesting speaker, sometimes it's reminiscing about things. It's just fun. Music and memory is bringing people's specific playlists that help with agitation or discomfort. It helps them relax and it has been proven to be hugely supportive. And then we have support groups and book clubs as well for the caregivers of those with taking care of folks with dementia. So I'm probably going to say this like 7,000 times before I finish. This whole caregiver piece is so, it's so important and it is so hard. I have been a caregiver for my in-laws and others, and there are times when I thought my husband and I were really in over our head. And taking care of someone is a great privilege, but it's also a great amount of effort. And caregivers have to take care of themselves. It's just a basic math problem. If you're not taking care of yourself, you can't really rise to the challenge of taking care of someone else. So that may be respite, which I talked about. The ADRC does have some respite funds, or if you're able to just hire on your own, that's terrific. It's it's a marathon. It's not a sprint. So it's really pacing. Counseling may be a need for a caregiver. Asking for help specifically. People do the, anything you need, give me a call. Well, you got to tell people what to do. It's not that they don't want to, it's that they don't know. So if you can say, you know what, bringing my garbage down to the curb every Wednesday would be a huge gift to me. Done. That's off your plate. So asking for help and being specific about what someone does. And, sometimes I think we enter this caregiving role in kind of a romantic light in terms of, I'm going to move mom in with me and it's all going to be wonderful because we will be together at this time and whatever. Life is messy and caregiving is messy and aging is messy and it'll be hard. There will be wonderful moments, but there will be hard moments, and that's okay. And to be realistic when you enter the caregiver journey, if you can be, is I think it helps people go the distance. The other thing I wanted to just throw out there real quick is some technology-based supports as we build our quilt. For folks with dementia, there's all kinds of wander guards that are available. So again, if they're walking out the door and not coming back, that's a problem. Medication management there's tons of resources to help medication management, help folks manage their medications. And then, we have seen the explosion of telehealth options through the pandemic. Kenosha Visiting Nurse already had a telehealth component to their program, so that it's with us, it's out there, it's available, and it is helping a lot. And I just wanted to share with you, just because he's so cute, we got a resource recently that is for our folks with dementia. His name is Murphy. And for many of our clients, having at a certain stage in their disease, having something tactile that is familiar, if you have someone that's loved dogs, can also be a really soothing thing to experience. So we're, okay, Murphy, shush. We are getting more and more and more creative as we learn what works for people. Okay. Okay, now we're going to talk about how to pay for all these services, okay? And I have, 10 minutes. All right. Well, clearly at one end of the spectrum, there is private pay. You know, people use their savings and their income to hire a housekeeper to take that off their plate for a couple hours. They can pay for really any service that is out there, can be received, can be accessed through private pay resources. For most people, there is a limit and a concern around making resources last, especially for couples. So the next category is long-term care insurance. A number of people have bought this resource. Like 20 years ago, it was pretty commonplace for people to start buying long-term care insurance, but they may not have, you know, it's time to pull that paperwork out and look at what it covers and what the conditions are of those policies, and be really familiar and make sure they're all still functioning well, because I think I have seen a number of people forget that they have policies or not use them to their maximum benefit. Then when we get into the quilt kind of thinking, we have some grants that are available. We have the National Family Caregiver Support Program and the Alzheimer's Family Caregiver Support Program. Those are two grants that run through the Aging and Disability Resource Center that can offer some respite. We have donation-based. One is our medical equipment loan closet. Again, we give people a donation envelope, but whatever you want to give is fine. And that can save money, and it's certainly a good recycle situation. Our home delivered meals program and our pickup meals and our the boxes that are running through the Kenosha Area Family and Aging Services are donation-based resources. We also have volunteer-based resources like the Friendly Visitor. So depending on the situation, if you need a little respite and it's not available through the grant, a Friendly Visitor could stay with your person for an hour and give you a chance to take a nap or go for a walk. And then of course we have all those informal supports, and such as churches, neighborhoods, service organizations, family and friends. And I do think that we have to be more willing to turn to each other and help, because it does take a village. It just does. Also, don't forget, if you're working with someone who is a veteran, the Veteran Services Office is wonderful at helping people figure out what they might be eligible for through the VA and through the Veterans Benefits. There's actually a program called Aid in Attendance, which will provide some extra cash to hire a caregiver. And the first step, I'm always told, is to find your DD 214 so they can get the ball rolling on that. Lastly, we're going to talk about Medicaid. And Medicaid is health insurance for people who have, I don't know why this thing is skipping, for people who have limited resources financially. Here's my little story about Medicaid. So it is a partnership between the federal government and the states. They both put money into the Medicaid pot. The feds, however, because they're the feds, get to set all the rules. So one of the rules for Medicaid is that it cannot pay for any sort of custodial care and support, except for long-term care, which means it's going to go on for a while. Whatever the problem is, it's going to go on for a while, except for nursing home. That's the only thing that Medicaid will pay for, according to the feds, for long-term care. So what most of the states have done is they've gone to the feds and they've said, well, that just doesn't make sense. What if we serve the people who would otherwise be in a nursing home, but we serve them in the community for less money than that nursing home bed, or at least no more money than that nursing home bed. And everybody's happier because people are where they want to be. And the states ask for a waiver of those federal rules. And then the feds say, okay, well, that does make sense. So sure. So Wisconsin has 4 waiver programs. They're called Partnership, IRIS, Family Care, and PACE. And those programs are how we help people remain independent in the community. But you have to be eligible. You're eligible for them financially and functionally. So we aren't serving people who wouldn't otherwise be in a nursing home. And we're serving people who have no other way to fund their care. So the front door into those programs is the Aging and Disability Resource Center. So you come here, we do what's called a functional screen, and it's an assessment. And we figure out whether or not you meet that nursing home level of care. And then we refer you to the Medicaid office if you don't already have Medicaid, and then they walk you through that process. Once those 2 things are in place, someone is functionally eligible and financially eligible, then we help you figure out which of those 4 programs is best for you. And once you figure that out, then we help you figure out which of the providers of those programs is best for you. So family care is kind of a traditional case management model. It's a nurse and a social worker, and they approve services. So they buy services for their clients. IRIS is what's called self-directed. So you get a budget and then you figure out how you want to spend that budget. They will pay for assisted living only if you are with Family Care and Partnership. So there's a bunch of those little rules and considerations that our staff will talk you through. Lastly, there is a Medicaid card services where you can just purchase things if you are Medicaid eligible straight up. There is personal care that Medicaid will pay for, and Medicaid will also pay for medical transportation. Now, a note about Medicare. Medicare is a health insurance program, and a lot of people think it's going to pay for stuff when they need help, and it really does not. It pays for health care only. So if you are in the hospital for 3 days, if you're admitted as an inpatient, it will pay for a short stint in a nursing home for rehab. But Medicare is solely focused on doctor, hospital, therapies, medications, labs, those kinds of things. Where the Medicaid programs I just talked about can pay for a caregiver coming in to do a bath, a ramp outside the house, meals coming in, all kinds of different things. That makes sense? I went really fast and I have 3 minutes to end. Okay, so planning ahead is our last bullet, and that is really just understanding kind of what your situation is, how to plan for the progression, and what is the prognosis. You know, what we wish happens and what are the realities are two different things. And I think we got to hold them both at the same time as we move forward. Looking also at safety as a big issue. You know, is this person driving and maybe shouldn't be? Are there guns in the house and they have a cognitive impairment? Wandering and general vulnerability. Say they live alone and they, you know, answer the phone to anybody and make a donation to anybody. Is that what's in play? What are the vulnerabilities for this person? I am a huge advocate for making sure you have your power of attorney for healthcare completed. That is the way that we control our future healthcare decisions, is by putting someone we trust in a legal position to speak for us if we cannot speak for ourselves. And in Wisconsin, we are not a next of kin state. So a wife of 60 years, a child has no guarantee that they can make healthcare decisions for their loved one without a power of attorney for healthcare. And most nursing homes and assisted livings won't allow an admission to that facility if the person cannot sign themselves in or they don't have a power of attorney for healthcare. So that's a really important document. We have lots of people in the community that are willing to help complete those documents. The ADRC has office hours Wednesday morning, but we can be flexible too. Frederick South has their chaplains will set up an appointment with anybody to complete a healthcare power of attorney, and Hospice Alliance social workers will as well. It is 2:59 and I am at my end slide.